Today we're going to be taking a look at diabetic ketoacidosis, which is a medical emergency that can be seen in diabetic patients. Before moving directly to diabetic ketoacidosis, it's important to understand the functions of insulin first. So if you remember, what normally happens is that when we have high levels of blood glucose, it triggers the pancreas, and more specifically, the beta cells of the pancreas, to start secreting insulin. And this insulin can help to reduce blood glucose via two main mechanisms. The first involves increasing glucose uptake. And what happens here is that insulin binds to its receptor, and this triggers a transporter called GLUT4 to fuse with the cell surface membrane. And glucose is able to enter the cell via this transporter system. The second mechanism of insulin action is to increase glycogenesis. And again, insulin binds to its receptor, and glucose is able to enter the cell via GLUT4. But this time, upon entering, the glucose fuses with other glucose molecules to form a long chain of glycogen, and this is useful for glucose storage. Let's now take a look at an example where there might be insufficient insulin present within the blood. And a prime case where this might occur is in type 1 diabetes, where there's an autoimmune attack on the beta cells of the pancreas. Over time, this beta cell destruction means that little or no insulin is being produced, which has two main effects. The first being decreased glucose uptake, and the second decreased glycogenesis. And this can have multiple effects on the cells. So just to walk through this process, with insulin unable to bind, the GLUT4 system can no longer fuse with the cell membrane, and glucose can't enter the cell. And this means that there's now going to be less glucose present in the cells, and more glucose being in the blood. As a result of these changes, glucose is unable to be metabolized as efficiently as before, and this results in decreased energy production. And if this process is left uncontrolled for too long, the liver cells have to find alternative fuel sources, such as fatty acids, and breaking these down into ketones for energy. And these ketones can then enter the bloodstream and result in some of the signs and symptoms which might be seen in diabetic ketoacidosis. Putting all this information together, we can now define diabetic ketoacidosis as a medical emergency which occurs due to a lack of insulin, where the body starts breaking down fatty acids into ketones instead. And this can occur in either type 1 or type 2 diabetes, but it's far more common in type 1. If you take a look at the causes of diabetic ketoacidosis, the most common is poor insulin control, where insulin injections aren't administered on time. There could also be infections or stress related to surgery, which can cause this. In terms of the diagnosis of diabetic ketoacidosis, we can look at the terminology itself. So diabetic means that the blood glucose values are raised, and usually above 11 millimoles per liter. Keto means that the ketone bodies in the blood are also elevated, usually above 3 millimoles per liter in the blood or present in the urine. And acidosis means that the pH must be below 7.3 or the bicarbonate levels less than 15 millimoles per liter. And we can use these three changes to diagnose the condition. We can also use these features to work out the signs and symptoms of diabetic ketoacidosis. So in the case of hyperglycemia, patients may experience an exacerbation of their normal diabetic symptoms, which could include increased polyphagia, polydipsia, and dehydration. In terms of the ketone bodies, when these are elevated, there might be fruity breath due to the presence of acetone, as well as abdominal pain. And for the metabolic acidosis, patients may experience Kussmaul respiration, which are basically deep sighing breaths in an attempt to restore the acid-base balance, in addition to nausea and vomiting. There could also be electrolyte changes, and just to explain this, in the renal system we have a hydrogen-potassium exchanger. So as the levels of hydrogen ions increase or the blood becomes more acidic, these can basically exchange for potassium ions, resulting in a hyperkalemic picture. As diabetic ketoacidosis is a medical emergency, it's important to recognize and treat the condition as soon as possible. And we usually start by treating the dehydration symptoms first, replacing this with IV fluids such as 0.9% saline. In terms of the hyperglycemia and hyperkalemia, we can treat this with a fixed insulin infusion of 0.1 units per kilogram per hour. And the way this works is that when we administer IV insulin, it can drive both glucose and potassium into the cells, decreasing their blood concentrations over time. Note that there might be an overcorrection where potassium levels decrease too much, so it's important to monitor the levels consistently and replace with potassium chloride if necessary. Finally, it's important to identify and treat the root cause. So for example, in the case of an infection, we can treat this with antibiotics, and we can often combine this with VTE prophylaxis, such as low molecular weight heparin. In terms of resolution, we can look at the pH, bicarbonate levels, and blood ketone levels to work out when a DKA has resolved or improved, and we can use this to guide our management as well. And here we have a quick summary slide outlining everything I've gone through in the video. If you have any questions, please leave them in the comments, and I'll see you in the next video.